Transoral robotic surgery stands for, or TORS, is a procedure that's performed using a Da Vinci intuitive surgical robot to perform procedures within the oral cavity or oropharynx. Previously, performing operations in the back of the throat was very difficult just because of angles and getting to tissue, and using the equipment that we now have didn't allow us to go around certain corners. And now, with this new technology and new imaging and tools that are used at the end of the robot, we're now able to manipulate certain instruments that can get around these corners and give us access to places like the back of the tongue, the tonsil, and the top part of the voice box, the supraglottis. More recently, the FDA has approved operations using the Da Vinci intuitive surgical robot for small cancers, T1, T2, oropharyngeal, and supraglottic cancers, as well as benign disease. And this is interesting because previously, once upon a time, the only way of treating these cancers was to do a very big surgery. And then as time evolved, we found that some of these cancers could be treated with chemotherapy and radiotherapy. However, those treatments do have side effects, and now the pendulum has begun to swing back towards surgery, and some folks for very early cancers have suggested using transoral robotic surgery to minimize the morbidity or the side effects that the patient may experience, and hopefully forego or reduce the amount of adjuvant treatment, that is, chemotherapy or radiotherapy, after they've been surgically treated. This is yet to be determined, and many institutions, including ours, are performing research into this area. The other interesting thing about transoral robotic surgery is that it allows us to address the base of tongue for patients with sleep apnea. Previously, the base of tongue was notoriously difficult to address with any surgical technique, and there have been many different types of procedures developed to try to address this. However, robotic surgery allows us to resect the base of tongue in one procedure, essentially. There was minimal morbidity to the patient, and then those select candidates where the base of tongue is causing obstruction, we can essentially remove that obstruction at one sitting. We've had a number of patients who have had a very successful outcome with this procedure and have now reduced their CPAP requirements or are not using it as frequently. They've been able to breathe more freely during the day and evenings, and their energy levels have improved significantly. This is an area that's obviously undergoing dramatic change, and right now, within the United States and the world for that matter, there's ongoing research and development with robotic surgery and determining different procedures that may be applicable to the robot. And at OU Medical Center, we are leading the way in performing research and trying to develop further technology that may be able to help us with robotic surgery within the throat and perhaps other areas of the head and neck.